that's the way that my hair accurately describes how this shift went, so let's recap it. I was charge nurse this shift, and right when I came on, they're like, hey, they're putting a chest tube in on a patient, can you go assist? So I went and helped put a chest tube in before even getting report on everyone, so we did that. And then I got report from the night shift nurse on all the ICU patients. Immediately when we finished with that, we needed to intubate someone. So went ahead, assisted with that intubation and all the things that come with. And then another nurse called me like, hey, can you ultrasound some labs? So I ultrasounded some labs that she was having a hard time getting. When I was finished there was a new patient that needed settled. So I spent a lot of time getting that patient kind of settled, labeling stuff, things organized for the nurse. And then I had a quick sec to check my emails and then went to go do rounds, but they ended up canceling them because we were absolutely slammed. Left that to go to a rapid response, and then I got called down to the ER to help with a really sick patient. They needed some extra hands from the ICU, and that patient ended up coding and spent quite a bit of time down there. When I got back, a nurse called to ask me to draw some blood cultures because she was having a hard time sticking this patient, so used an ultrasound, got those. Then I went down and returned my RSI kit when I got called to another code blue. I was in this code blue for quite some time, and afterwards I was able to go grab a bed for a nurse that was transferring a patient out of the ICU, and then came back and helped set up an EVD for another patient. After that EVD was done, I transferred a patient out of the ICU, and then a nurse called me to help with a duo tube placement, so I went and did that, and then I did take my lunch break, so there's that. After my lunch break, there was another code blue called that I went and was in that code blue for a little while, and when I got back, a nurse needed a bed change, so I helped change the entire bed. Towards the end of my shift, rapid response was called that turned into a stroke alert, so spent quite a bit of time doing the stroke alert stuff for the patient, and then got back to the ICU at around 1800 and did my rounds on all of the nurses and finished up, and I walked, last I checked, like 7.62 miles this shift, so I was busy, I'm tired, I'm ready to go home, and that was my shift recap.